I'm going to say yes. So he's coming on around 8:20 or so. We did have some comments. This is relative to we played a little interview we did with the governor, and she said that the public health, the resolution to end the public health emergency was a surprise. We had some comments here. A surprise? Is she joking? Rosemary says she's so disconnected. Um, Samantha Baker comments, there are more police officers with brand spanking new vehicles, yet I never see cops patrol around my neighborhood unless they're called. Rosemary has taken her over 3 years to address police presence island wide, and she believes that pay raises is the answer. What is this emoji? The hand to face emoji. They need to add our elected leaders to the neighborhood watch chats of all the villages and the community pages on Facebook. Desiree comments, just last week I saw GPD cleaning up some gravel off the road, waste of time on their behalf. It should have been Public Works or someone else. Good morning, guys. Christina Marie Salas comments, are we going to act like Guam's drug problem is not embedded in its system also? Drugs are being cultivated more than culture. Wow, Christina. Heavy comment there. Good morning. Donovan Seimer says, good morning, Chris. Good morning, Donovan. Thank you, Dr. Hoa Nguyen. He's the former chair of the Physicians Advisory Group, and he's been a regular right here on the link. Good morning, Doc.
Well, good morning, Chris. Good morning, everyone.
So we just get right into this Resolution 291, which would end the public health emergency. I know it's been put on the agenda for the legislature, and they are anticipating this thing hitting the floor. I think April 14th was the date that I got. And they're going to go into committee of the whole, Doc. So I'm assuming what's going to happen is we're going to have a bunch of the cabinet members out here at the Guam Congress Hall, kind of justifying the extension of this public health emergency. But Doc, I'm pretty sure I've been seeing some of your comments, and I know how you feel about it because we've been having you here on the link. But before we get into where exactly you stand on the public health emergency, we were talking before the break about the state of Guam's healthcare system 2 years after COVID. Is it better? Is it worse? Is it the same?
I think compared to 2 years ago, we are not getting better. We are getting worse. So I don't think that during the pandemic, we do not spend much of the money on kind of upgrading our healthcare system. I think, I don't know where the money for the healthcare go, but GMH are, regarding improvement for response to the COVID, they have great improvement on their way to treat the patient and how to triage and how to take care of the patient in the hospital. Dr. Julie Nagan and the team have been doing a wonderful job in doing that. But otherwise, there's no much resource for nursing that I can see. There's no money for the upgrading the clinic as an outpatient. So that those are the stuff that we need to invest in order for us to improve the healthcare system as a whole, and also for us to provide a better response for any type of surge or pandemic in the future. Right now, as you know, that both GMH and GRMC kind of depend a lot on the travel nurse, and it's and the travel nurse have nothing to do with pandemic emergency. That's the different type of fund. But GRMC, like about 50% travel nurse, and I don't know what GMH is. I think they have over like 150 plus travel nurse. And once a travel nurse go away, because they're very expensive, we're going to go back to the same scenario that we had pre-pandemic, is that we're going to have a shortage of nursing staff, which is translate to a shortage of bed in the hospital for admitted patient. Because, we're talking about shortage of bed before, and the hospital is full pre-pandemic, not because we don't have the physical bed, we just don't have the nursing staff.
Yeah.
I don't think that we do anything in the past 2 years to try to improve or address the shortage of nursing staff. We should do a whole lot in the past 2 years, and like investing on UOG and GCC, and try to expand their nursing program to increase the number of nursing students going through. Because right now, I think the limit number is like 30 a year if they have 30, because some of the nursing students go through the program does not make it all the way through because it's a very, very tough program.
Yeah.
And we end up graduate very little nursing staff from GCC and UOG. And that's something that I think that we didn't address the long term on this. So that's why I say that our healthcare system remains the same or worse, just because we didn't put much thought on planning ahead on this. So yeah, it's just not. And even the private clinic, which to me, the pandemic cannot be going through what we go through right now without the private sector coming on the private clinic going through, right? Because they stand up a lot. The 3 tier 2 clinic already modified their practice to respond to the pandemic because we the order of the governor in taking care of everybody that walks through the front door.
Doc, let me put on my devil horns right now and play a little bit of devil's advocate. So, what you're saying about 2 years after the start of the pandemic, healthcare system, the same or worse. That kind of sounds like what the governor's saying is her, other than the money, is part of her reason for extending this public health emergency is that our healthcare system is not capable of dealing with, crazy surges. So what would you respond to that?
I think that the pandemic response emergency has nothing to do with that. I tell you, the hospital can, the travel nurse have nothing to do with pandemic emergency, a different type of fund, okay? And the response is really from public health, from the guard, and from the private clinic. But again, if you want to stay on pandemic emergency, then you need to start doing a lot of investing on the healthcare system in order to improve, right? We didn't have anything to invest on the healthcare system in order to improve. We just put the fire out, but we don't do preventive stuff. And we don't do any planning to kind of upgrade the healthcare system in order to prevent us from going to a pandemic emergency. You know what I mean, right? I mean, that's just put out the fire. You have to plan ahead to improve the system so future surge can be better handled.
Doc, I wanted to ask, with this resolution 291 that would end the public health emergency, it seems like we can't get an accurate read for whatever reason about exactly what is going to be in jeopardy if we lift the emergency and what parts of the emergency do we need a declaration of emergency for. I was thinking it would be great if we had like a graphic where it said, with the emergency or without the emergency, this is what we would lose because, we had the governor come out and talk about losing the emergency SNAP benefits, but then we had some of the senators saying that wasn't accurate. Others were saying it was. Some were saying you need a declaration for FEMA. Others were saying you don't. So when we get to the legislature and they start discussing this, are you looking forward to that discussion so that we can find out, accurately what we need at a state of emergency for and, what we don't?
Yeah, I mean, for me, right, I would say that right now you cannot cut off the pandemic emergency declaration, the turn off the light. You cannot. There's a lot of project, a lot of program that need to kind of be winding down and also to need to put certain things in place. But the problem is that I don't think that any agency have any plan to terminate this. And, that's the part where I say they need to be put an exit plan together. That's why I say during the hearing, They need to put an exit plan together, supervised by the governor along with public health and the legislature uh, as a kind of check and balance thing, and also put a timeline with home people responsible to meet the timeline. Right, right now, I know we see the timeline of the mask mandate and the indoor mandate out there that will be a month from now.
Yeah.
Okay, but again, that's just a mandate, and the mandate is not pandemic emergency, right? So that's two totally different issue. The address they want is a mandate for the mask and the indoor gathering, but there's no plan for to ending the pandemic emergency declaration. That's the part where we want to know is when's the end. And I know that in order for us to end this pandemic emergency, is we need to be ready to respond for the next surge. But again, if we are in this thing for 2 years already, and we are not ready, that means that whatever we do in the last 2 years, we didn't do correctly. So we should learn a lot already in the last 2 years. So to me, they're always going to have a potential for a surge. But from what we did in the last 2 years, we should have that down as a cookbook already of what to do in order to stand up another process for to fight the surge. So. And we always know, guys, that there's a surge coming, right?
Yeah.
Chris, we see Delta, we see Omicron. I told you that's going to come. But for what reason, we only respond a little bit too late. And that's the part where we need to learn that. And again, in order for us to be ready, we should be ready already. So it shouldn't be a pandemic emergency to be ready to respond. And that's why I'm trying to say that the process should be in place already in the past 2 years.
Right. Yeah, Doc. I mean, I feel you on that. We're out of time, but you're right. With these surges, I feel like the last couple big surges, it was weeks of us kind of complaining about what was going to be done to respond to the surge. So I'm hoping if we ever do have another surge, that the response is quicker. But I'm knocking on wood furiously because I don't want one either. Doc, have a good weekend.
You too, guys. Just be safe, and I think that it's near the end. We are in endemic already, so you won't have to wait. I tell you, we're in the endemic phase already.
Yeah, I sneezed the other day, and no one said COVID, so I think it is over. If I sneezed 2 months ago, people would have been like, "Oh my God, ah!" But they're like, no one even noticed. Thanks, Doc.
Chris, we're going to try to work on a program, Eugene GCC, and we got to increase our nursing staff student. And open, we should be about 50, 60. And I tell you, the doc in the community, we are ready to stand up and help Eugene CCC and the teaching staff. We have to solve the long-term solution of shortage staff, the shortage of nursing staff in Guam.
Okay, Doc, thank you. Let me know if you need help with that, and we'll get you on again.
Okay, guys, thank you.
There you go, Dr. Hoa Nguyen. He's the former chair of the Governor's Physicians Advisory Group. Rosemary, the agencies have no exit plan because they haven't been instructed to provide one. In the earlier press clip, the governor adamantly said she refuses to sit with the legislature to discuss this situation. Okay. So good morning. It's 8:02.